Okay, OET letter assessment number 3. As always, disclaimer, fair use for teaching purposes. Okay, just get that out of the way as quickly as possible. So we've got Mr Adam Knowles. Just get it up here and let's have a look. So if you saw video 1 and 2, you know how this works. There's a particular method, approach that we can use. So first, identify audience and purpose. Okay, go through the notes, decide what you will include, what you'll exclude, then transform them into grammatically complete sentences, and lay out the letter in a logical way, putting yourself in the shoes of the reader. So if your letter is written correctly, the reader should be able to clearly understand precisely what you want them to do, and they shouldn't need any other information. They should need to compare it to any case notes. Now, obviously, that's what will happen in the exam. But if you think about it, in real life, that's how it should be. All the information the reader needs should be in your letter, and that's it. So, go to the task first, as always. Let me get my pen. And I've got the criteria here, so I'll show you what I mean. So, we're writing referral to a gastroenterologist assessment of Mr Knowles. It's the plan, urgent, assessment, endoscopy, possible pancreatic malignancy. Okay, so we know who we've got to write to, what type of letter, and what it's about. Okay, now why is that important? Because your purpose must be immediately apparent and expanded over the course of the letter. The audience, content appropriate to the reader. So if it's a gastroenterologist, you don't talk about asthma or fungal feet or something such as that, okay? Also, what don't you need? Irrelevant information. Again, as I just said, we don't need fungal feet or asthma. So these are two sides of the same coin. This is what you must include, and this is what we don't need. And it's also about how well you summarize it and present it. Genre style, again, audience appropriate to the reader. This is about the jargon and language. Make sure that it's appropriate for the reader or recipient. Then this refers to how well you tell the story, the layout, is it logical, and then we've got language features at the end. You can find this on the OET official site. You can download this. Purpose, so quick, precise, dear reader, I want you to do blah blah blah. As again, quickly, efficiently, immediately identifiable. Then you expand it. You usually repeat it at the end, often near the end of documents. In view of the above, I would appreciate it if you could, etc., etc. Then you've got the content, conciseness, as we said, what you must include, what you shouldn't include, appropriateness, jargon, tone, to the reader, organisation, very important, and language. But as you see, this is only to the extent that it interferes with comprehension or speed of comprehension. Okay, so there we go for that. And we've got a sample to refer to. Now these samples, as they've said, they're not perfect, but we can use them to give you some general idea. And once you've got your audience and purpose, you go up to your notes. Sorry, I'll just pause this a second. We have some ambulance outside. Okay, it seems to be okay now. So again, go to the task, go to the plan, audience and purpose, and you go through your notes. What don't we need? What do we need? Go through those, and then we've got to transform these into grammatically complete sentences. So let's have a look at yours. Okay, changes, right. Writing to request, right, we don't need an article. Urgent specialist assessment. Endoscopy, 68 years old patient who might have contracted with, who has, right, so first, I would put the name. I'm writing to request assessment endoscopy for Mr Knowles, age 68, whose signs and symptoms suggest or are suggestive of pancreatic malignancy. So you can do it something like that. And symptoms are suggestive. A little bit more formal. So might have and you can contract a. I'm not sure if you can really contract this, but no. But anyway, it's a little bit informal. Might have contracted, so you can say this. Whose signs and symptoms are suggestive, and I'll put the name Mr Knowles, age 68. Now, the other thing here, we don't do title and first name unless it's a child. So if it's like a young child, you do Mr Adam. If it's a teenager, you can do it, maybe, but up to a certain age, you don't. It's always the title, family name. So Mr Knowles, not Mr Adam, Mr Knowles. Besides, he's a pensioner. So if it's a senior, you don't use the first name because it's not respectful, not appropriate. Mr Knowles. Mr Knowles presented on remarkable, commenced on episode question along with a review and 4 weeks. Now, what the sample does and what some of you have done and what you can do is put the urgent visit as visit number 2. So you've got your opening. Thank you for seeing. I'm writing to refer, request, blah 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 blah. You've got the name. You've got the age. If he's retired, it doesn't matter what his previous job was, so I wouldn't use that. So again, these samples are not perfect. You've got the urgent part. Okay. So this is the visit. I would have put it today. Mr Knowles presented with blah 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 blah. Okay, and then the first visit, so you can see how it's got worse. So you've got the urgent part first and then the previous visit. You can do it like that. This one here is more I've done it like a chronology, a straight chronology. Complaints of heartburn, do you suggest after 4 weeks? In other words, today, no improvement, develops severe backache, diarrhea, pale stomach, double pain, 2 kilograms. Okay, so you could do it like that. If there's a history, anything that fills in the story, you can put that at the bottom. Professional assessment. Well, obviously it's going to be, you're not an amateur. Assessment required. Blah 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 blah. Okay, so that's not bad. Okay, let me have a look. So that's basically the structure. You've got your opening, the current visit, which leads you to make the urgent request, bit of background, he came a month ago, blah blah blah, some general history that might help to fill in the story, and the request again at the end. And this is where you can put the appreciate, I'm so grateful for. You know, I wouldn't put it in introduction like some people do. Okay, not too bad, not too bad. For Mr. Knowles, urgent assessment. Okay, I would have maybe mentioned the possibility, pancreatic, malignancy. I would maybe put that there. You've got the DOB, so you don't really have to put the name. You can do. Age. Today, presented history with a 4-week history. Well, it's not really a 4-week history, is it? It's like with history with a 4-week history. Or Mr. Knowles presented. Now, if you look at these, for example, simply, you can do it like that. Has lost 2 kilograms over the last 4 weeks. So you can put a history of, or presented complaining of presented with a 2 kilogram weight loss in the last 4 weeks. If it's the first, an ordinal, put a definite article. Discoloration and yellowish discoloration of skin and eyes. We don't need more. Moreover, OET says if you can take a connector out, it doesn't change the meaning, then you should do so. On abdominal examination, or his on examination here. Now, right, it presumably refers to the abdomen. So, on examination, his abdomen, that's better, appeared slightly swollen. Oops. Okay, that's better structure. Internal palpitation, pathology supports. Okay. Initially, Mr. Knowles presented on the 2nd, complaints of heartburn, not with these. Okay, examination was normal. Therefore, we don't really need that. As I say, none of these sample letters use these kind of connectors. Look, there's no therefore, there's no hence, but thus. It's simply a report. This happened, I did this, he did that, he's, so we don't really need those. Okay, now, he was advised to review himself? No. He was advised to return for. And you don't usually advise, you tell them, I want to see you again in 4 weeks' time. Not, I advise you to return in 4 weeks' time. That's not how the doctor would actually do it. He would say, okay, I'm going to give you a couple of tests. I want to see you again in 4 weeks' time. That's how the doctor would usually do it. Told. You don't advise them. You tell them, don't you? I want to see you in 4 weeks at a time. Today, now, I don't know why, right, this particular one, you've got the visit today, then you've got 4 weeks ago, then you're jumping back to you today. Why would, surely this would affect the organisation score, right? So this needs to be, this needs to be put in the visit for today. Okay, right. So, eating, and a 2 kilogram. Okay, so you'd have to do it like that, because if you don't, it's going to affect the organisation score. Okay. Active person. It's okay. That's not bad. What about a possibility? You wouldn't say that. You would say, in view of the above, Mr. Knowles. Sorry, there's a bit of noise outside my office window. for today. Right, that's gone now. So you wouldn't really say this. I'm worried about the possibility. You'd probably say something like, in view of the above, I would appreciate it if you could investigate him, the possibility, you know. So we wouldn't really have that there. Okay, in view of the above, can you investigate the possibility of? So probably get rid of that. Therefore, do the above. Highly appreciate if you could investigate Mr. Knowles. If you could investigate him, possibly. Just change this. It's easy to just drag and drop this. So probably do it like that. Mr. Knowles by endoscopy to confirm the possibility which has been discussed with Mr. Knowles. Okay, this is a bit messy, but you know, you can see, you get the general idea. I'm not typing it all out, so it's easy for me to drag and drop. It's a bit of a mess, but you know, you get the general idea, I'm sure. Okay? She could do it like that. So, highly appreciated, investigate, to confirm, blah, 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 blah. Okay, so not too bad, not too bad. Just a few things that we could change the organisation, I think. Now let's have a look at number 3. See what we can do there. Okay, so needs to be capitalised. Okay, Mr. Knowles, management consultant. That seems to have come straight out of the case notes. Retired management consultant. It's basically lifted straight from a sample. I wouldn't do that. I would paraphrase. Now, we don't really need this. You can put the appreciation here at the bottom. Mr. Knowles visited with heartburn despite taking the remarkable, except for overweight, except for being overweight. We don't need therefore. It's not an essay. Was prescribed, and some blood tests were ordered, as well as, and some blood tests were ordered. Then Mr. Knowles' condition not improved. In addition, you don't need these. As I said, OET say don't use them. If you don't need them, don't use them. As long as not improved, you can put in the back pain, abdominal pain. I didn't use a conjunction, abdominal pain after eating. Tiredness, abdominal pain. Now, right, after abdominal pain after eating and tiredness. So, okay, let's get rid of that. So, back pain, abdominal pain after eating, put a comma, and tiredness. Bowel movement was frequent, together with loose pale stools. Well, okay. Parameters, that's 2 kilograms of weight. Again, apart from what? Isn't that part of it? Oh, sorry. More noise from outside. I'll just have to pause. Okay, so we don't need this together with loose pale stools. So back pain and tightness. 2 kilograms of weight. I would put that group of symptoms together. As long as it's not improved. You go with back pain and tiredness. Back pain, eating, tiredness, and he's lost 2 kilograms of weight. Bowel movement, okay. On examination, his investigations report. Okay. Now, for this reason, we don't really need that, and we wouldn't put a comma in any case. So you have to talk about, he wasn't informed. You had a discussion, I believe. We had discussion. Discussion. It wasn't just informed. Ruben, I discussed the possibility of pancreatic malignancy with Mr. Knowles. Malignancy. He was informed, or simply we discussed the possibility. Okay. Then you've got a bit of history. Oh dear, this sorry, it's pretty noisy outside here again, but you know, I've got to make these videos when I've got time, and this is the only time that I have in the day. So we will continue as best we may. So you've got brief history to fill in the story. We don't really need this. Depression, what's that got to do with anything? So we need to restate the request. In view of the above, I would appreciate it if you could, blah, 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 blah. Okay, and that's what we would do there. That would work fine. Again, let's have a quick peep. So, the structure here. Okay, you've got your greeting, reason, purpose. Can you see I'm writing to refer, request, blah, 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 blah. You can do it today's visit, because that's the urgent bit. Then the initial one, with a background to fill in the gaps in the story. Then I would appreciate it, I would be grateful if you could, blah, 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 blah. You can do it like that, or you can do it like a chronology. You know, I don't think it makes a lot of odds really, as long as it meets the criteria. So I to refer Mr. Knowles, 68-year-old male. Well, okay, we kind of guess from the title. Features are suggestive. Aha, that's good. Urgent evaluation and the possible endoscopy. Right, that's pretty clear. So we're doing a history here, a chronology, not today's visit. Mr. Knowles presented with complaints of heartburn despite taking antacids. Function tests were advised. Well, you don't advise people to take tests. You tell them. You're the doctor. They come in and say, okay, well, Mr. Knowles, I'd like to do a function test and a blood count. We need to find out why your symptoms are blah, blah, blah. You don't say, I advise you, not in this particular instance. And again, therefore, we don't need it, despite taking antacids. I requested a liver function test and a full blood account, and Mr. Knowles was commenced on. Okay, so you can do it like that. We don't really need this here. Mr. Knowles reported no improvement. Well, Mr. Knowles returned and reported no improvement in his symptoms. However, he developed backache. He had developed past perfect, lost 2 kilograms in weight since the last visit. Additionally, you can use that, okay, abdominal pain, diarrhea. I think do you have a no there? Yeah, you spelled that right. I can never remember how you spell this. That's it. Abdominal pain, diarrhea, pustules, examination, jaundice, abdominal tenderness, whether this is okay, that's good. Got sex with gallstones, 14, depression, appreciative things, and now, this is good. Very good. Very good. Okay. Very good. This would certainly do the trick. This would do. So you've got your greeting, visit 1, visit 2, what's going on, a bit of history, in view of the above, my diagnosis is, etc. Okay, that's pretty good. So this is their example, and this is the final letter here. I think this final letter is pretty good. I'll just put it on the screen so you can see all of it. Okay, it's not bad at all. Right, hope that helps. So in general, these aren't bad. I think the final one is the best one of all. Okay, you know, bit of language issues. We don't really need some of the connectors. We don't really need it. Change a few things around. Bit of grammar. The structure here didn't really work. Needed changing around a bit. Bit of grammar, etc. This was not too bad, but again, watch your pronouns, etc. So, okay, not too bad. Hope that that helps. And when people finish writing task number 4, I'll take a look at that one. Okay, that will do for today.